There are studies showing that there is an association between type 2 diabetes and poor cognitive function in humans, not necessarily dementia and not necessarily an association with Alzheimer's disease per se, but there is but the epidemiological studies shows that there is a poor cognitive function in individuals that have type 2 diabetes. How that can happen? So one pathological characteristics of amylin is that can deposit in the microvasculature without co-deposition with beta amyloid. It can deposit in the microvasculature and impair the microvascular function. Now, what does it mean? It means that the nutrients and the oxygen that is transported from the blood to the brain, it's impaired. Yeah. And yes, in fact, it has been shown that in individuals that have type 2 diabetes, the brain microvasculature is affected by type 2 diabetes. What are the mechanisms? These are complex mechanisms. Might be inflammation that not necessarily triggered by amylin. Maybe might be glycated proteins, but certainly there is a component of the amylin pathology that affects the brain microvasculature. And here it's an interesting aspect that we published some years ago. We published that the amylin deposition in the brain microvasculature in individuals that do not have an Alzheimer's disease pathology, it's associated with a glial response, meaning that there is astrocytes activation in the brains as in association with amylin deposition in the microvasculature. So therefore, we hypothesized that this homeostasis of amylin and amylin accumulation in the microvasculature in individuals that have type 2 diabetes might trigger inflammation in the absence of the Alzheimer's disease pathology. So that probably is generating downstream pathological processes that will affect the brain function in individuals that have type 2 diabetes.